Hi, I'm Mark Raven. I'm going to be your host for this multi-part video discussion series about lean design in healthcare. And this series features two leaders who collaborated in the design of an innovative healthcare facility, the Mercy St. John's Rolla Clinic in Missouri. And these leaders are Miguel Burbano of the Neenan Company and Dr. Randall Huss, the president of the Rolla division. So to see the whole multi-part video series, we'll have about an hour of video altogether. You can track the release of new videos at www.leanblog.org/leandesign, or you can subscribe via YouTube or through the Lean Blog video podcast feed in the Apple iTunes store. So I hope you'll enjoy the series. I hope you'll appreciate the discussion and the insights that Miguel and Dr. Huss are going to share about their experiences applying lean methods to the design of a new healthcare facility.
My name is Miguel Burbano. I am the Director of Healthcare for the Neenan Company, and I'm a Senior Vice President. I direct the healthcare group, and we have been involved in healthcare directly for 18 years. I've been involved 30 years in healthcare, designing facilities all over the United States and overseas. I'm quite passionate about it, and I'm grateful to have the opportunity to work with clients such as Mercy in very innovative projects.
Yeah, I'm Dr. Randall Huss. I'm the Rolla Division President for St. John's Clinic. We're the integrated physician arm of St. John's Health System, a large integrated health system, part of the Sisters of Mercy Health System. We're located in South Central and Southwest Missouri, extending into a bit of Northwest Arkansas, Eastern Oklahoma, and Southeastern Kansas.
Our company is a collaborative integrated design firm, and the traditional roles of or positions in a project vary immensely when compared with other firms. As a director or principal architect in the project, my job is primarily to surround ourselves with the skills and the talent necessary to bring about the project. As such, we bring very early many more disciplines than traditional architecture to the forefront. So demographics, strategic planning, etc. are part of the team that we lead. That aside, my role or my responsibility was to bring to reality Dr. Huss's request, which is a transforming healthcare facility for the Mercy system.
My role with this building project was, well, number one, it was in Rolla, my town, where I am the division president, and I was assigned the role as the system accountable executive for the project from St. John's Health System. I did take a 2-day full lean training session once after I had the initial introduction to lean, and that was during the design process. We had a very progressive lead architect, Miguel Burbano, who you're also interviewing for this, and Miguel has been very steeped in lean design and been involved in lean design for some time. So he was, even from the outset, gently pushing us in and challenging us to think lean in this project. So it really was a great synergy. I'd become very interested in lean and understood what it could do. And then with Miguel coming on as the lead architect of the project, we meshed together very well.
So Miguel, how did you personally and your firm get introduced to these lean principles?
The Neenan Company, I believe over 20 years ago, was part of the original group of firms in the United States that became part of the Lean Institute. It's an association of construction firms, general contractors, and others who are trying to apply Dr. Deming's and the Toyota principles of lean to the construction industry. This is has been a fundamental principle of the company from the beginning. The word archistruction, which is the moniker that follows our moniker, is about the joining of all the disciplines necessary to bring about a project. So lean has been a fundamental principle of the firm from the beginning. It's part of our training. All new employees go through lean training, mandatory lean readings, and there's several retreats and seminars that they must attend because we consider it a necessary discipline, complementary discipline, if you will. The lean movement is more than just lean design. It's the elimination of waste. It's about continuous improvement. It is about collaboration. It's about just-in-time production or delivery. It's about eliminating weight. At the end of the day, design is one of the many components that affect that delivery chain. Our firm integrates, because we're an integrated firm, we integrate all the disciplines involved in the delivery of a project in order to achieve a leaner, more efficient delivery.
And Dr. Huss, I'm curious, how did you first get introduced to lean?
I first became acquainted with the concept of lean and lean process improvement when our health system, which had been going down the path of the GE tools, the Six Sigma tools and the workout, CAP, etc., we added lean to our toolkit. And I had the first introduction was a lean for executives, kind of a half a day or an all day, I don't remember for sure, introduction to it. And through that, I understood that this is really all about the experience from the patient's point of view and looking for new ways of doing things that eliminate waste, that eliminate non-value added work, and how you identify that. So as I realized that what a powerful tool that could be, when this project came up, which was about the same time really as we'd started the design on this project, I realized this was very applicable to our not only our workflow processes, but then the design that would result from those workflow processes.
Miguel, how did you get started with St. John's Rolla, getting started in this lean design process?
Like so many things in life, it was quite accidental that the project took such a dramatic turn towards lean and towards efficient design. We had worked for the Mercy system in Rogers, Arkansas prior. The St. Mary's Hospital was needing an MOB, and we were fortunate enough to be selected by Cambridge Development to assist in that venture. Following that project, the Rolla system, or the St. John system, wanted to build a building in Rolla. At that time, the leadership felt that bringing together the clinics in the community of Rolla into a brand new building was necessary. Those were old buildings, and the first effort was quite traditional. Hire an architect, find a builder, go about building the facility. It wasn't until an opportunity arose from the selection of a different site that Dr. Huss chose that pause in the project, if you will, to redirect and reestablish the vision. By that time, I believe Mercy had also gotten obtained awareness, if you will, about lean, and he asked us if what would we do to make this a leaner project. Were we familiar with that? And that was the origin of the Rolla project.
Okay. Dr. Huss, I'm curious, as you got started working with Miguel and the Neenan Company, what was some of the thought process in terms of defining the vision and your ideas of what a quote-unquote lean facility was going to look like and how it was going to work?
Well, my first instructions to Miguel when we first met and we first were talking about the project, and this was even before we had the final design that we're in right now, but my first idea was I knew that we would be going into this building initially about the same time as we were going to go live on our electronic record, Epic. So I knew that we could do things that didn't have to be done like it had been done before. So my initial charge to Miguel and the Neenan team was, we're not going to build the same old medical office building that's been built essentially every other time that medical office building's been built up till now. If you think about it, they all more or less, I mean, despite, you can add a little gingerbread and a little, extra window dressing and make it real pretty and whatever, but in many cases the buildings were all the same building. They had big wide hall you walk down with doors with doctors' names on them, big waiting rooms, and in the old world, the fuller that waiting room, the better your practice looked. So I said, we don't have to build that anymore. We can build a new style of building. I didn't know what that was yet, but as we got introduced to lean, I knew that that we could make some changes that really would be fundamentally different than what had gone before.
Miguel, what were some of the key insights about how the St. John Rolla facility was different than a typical clinic would be?
Perhaps the best way to answer that is there's two aspects to our involvement in Rolla. One was the obvious construction side of the project. Are we building the best environment, the best shelter for a outpatient clinic? And are we using lean tools in those processes? The second part, and perhaps the most important, is that our company believes that buildings are more than shelter. It's fairly simple to provide protection from the rain, the wind, temperature in a comfortable, well-designed environment. What is difficult is to convert that environment into a working tool. And how can the building change processes, transform protocols, and improve efficiencies of the staff, providers, etc. And at the same time, create separation in the marketplace. So that's what we attempted to do in Rolla, and that's why the project is different. It blends both sides. The shelter side, if you will, of all buildings with the operational side of the facility.
Can you describe that collaboration about how you determined what the best process was?
Perhaps the most significant one was the intention by both parties, the design side, construction side, and the operation side, to eliminate waste. And so the elimination of waste and wait times and the reduction of improving efficiencies throughout the project was a high priority from the beginning. The project represents that goal in being a totally not totally, but 90%, 95% paperless solution from the beginning. It has digital technologies throughout, and that requires some transformation to the process. Secondly, the building, in order to achieve different protocols, is a significant departure in the traditional design or medical module, if you will, or medical pod or suite. It eliminated or transformed traditional job positions such as greeting and reception, eliminating those functions and converting those into production points. So the building is dramatically more efficient from a staffing point of view and a volume or throughput point of view.
Can you describe Can you describe the collaboration of how to determine what the best process was?
We made a visit, Mercy representatives, Dr. Huss, myself, to Park City, Utah, the university system in Utah, where the concept of the care team was originated. During those interviews, it became apparent, those tours, it became apparent that the traditional job description of, let's say, receptionist was an antiquated role given the fact that there's no longer paper. So when we started designing the project and you go through programming, we started questioning, do we need receptionists? What are they going to do? Do we need reappointment staff? What are they going to do? And so on. So it became important to, before we advanced design, to spend some time understanding the potential that this new technology had on the organization regarding job descriptions and process. So you're correct. That was there was quite a significant amount of time was spent. It was very iterative, making sure that we understood the new processes possible with new technology. There's a risk involved. Most architects are not, most construction firms, we shy away, if you will, from getting involved or sharing risk in process change, particularly on the client side. So the collaborative nature of our company allows us to become involved in those domains with a little bit more comfort and accept those risks in partnership with the client.